Thyroidectomy is a surgical procedure that involves the removal of all or a portion of the thyroid gland. Here are the general steps involved in a thyroidectomy. Anesthesia. The patient is given general anesthesia so that they are unconscious and feel no pain during the procedure. Incision. The surgeon makes an incision in the front of the neck, usually just above the collarbone, to access the thyroid gland. Identification of the thyroid gland. The surgeon carefully separates the thyroid gland from the surrounding tissue and identifies the nerves and blood vessels that are connected to the gland. Removal of the thyroid gland. Depending on the reason for the surgery, the surgeon may remove all or just a portion of the thyroid gland. If only a portion of the gland is being removed, the surgeon will carefully dissect around the specific area to be removed, leaving the remaining portion intact. Closure. After the thyroid gland has been removed, the surgeon carefully closes the incision with stitches or staples and applies a sterile dressing to the wound. Recovery. The patient is taken to a recovery area and monitored closely for any complications. Most patients will need to stay in the hospital for a day or two after the surgery to ensure proper healing and to manage any pain or discomfort. It's important to note that the specific procedures involved in a thyroidectomy may vary depending on the patient's individual condition and the approach used by the surgeon. It's always best to consult with a qualified healthcare professional for information specific to your situation.